So, the addition of FMIP, to restate some of these things, were really not expected to increase over-enrollment of high-risk Oregonians. Rather, what it does is it creates a new federal funding source for new enrollment of high-risk Oregonians, those individuals that would otherwise have gone to the Oregon Medical Insurance Pool. This will have an impact on OMIP's operating cost. It will tend to stabilize those costs, which I'll get to in just a minute in the next graph. OMIP will continue to contract with Regents Blue Cross Blue Shield for the third-party administration of both of these programs. So here's the chart on the operating costs that I just referenced. Again, if you look at that top line, those would have been the projected operating costs for the Oregon Medical Insurance Pool absent the federal pool. If you look at the middle line down, you will see that with the federal pool, the impact has actually kind of flattened out that line for OMIP's operating cost. They don't go lower, but they do tend to stabilize over the next few years. So, OMIP funding, for those of you who have been around, this is no news to you, but there are no state or federal funds that go into the Oregon Medical Insurance Pool. Currently, OMIP is funded roughly half by member premiums, and the other half is coming from health insurance company assessments. FMIP funding is very similar. We estimate that about half of the source for running that pool will be member premiums, and the other funding will be coming from the feds. The state of Oregon has been allocated $66 million total allocation for this program. The next chart, labeled non-premium funding, really refers to the OMIP assessment. If we look at the bar on the left-hand side, the blue bar, again, this represents what the OMIP assessment would have been absent the federal pool. With the existence of the federal pool now, the second bar, or green bar, represents the impact of OMIP now that we have the federal pool. So again, we don't anticipate a decrease in the OMIP assessment. However, it will tend to stabilize over the next few years. Now to rates. The OMIP premium rates by statute can be no more than 25% greater than the individual market average. Right now, OMIP is at about 17% higher than the individual market average. FMIP premium rates are equal, and this is actually defined in a requirement of the federal government. They have to be equal to the average market rate for comparable benefit plans. Now, some of the factors that actually influence the FMIP premium, and when I say influence, tend to increase the FMIP premium, are the requirement that FMIP have no pre-existing waiting period. This is like adding a benefit. There is a cost to not having a pre-existing waiting period. The individuals coming into FMIP are required to have 6 months without prior coverage. So we anticipate the individuals coming in, or this population, will have some pent-up need for medical services, which will tend to increase the premiums. The addition of a drug out-of-pocket limit, which I'll get to the specifics on that in a few slides, will increase the premiums, as well as 3 smaller impacts: membership and Weight Watchers, no co-pays for specific generics, or for flu or H1N1 immunizations. OMIP has 4 benefit plans, as most of you know, named for their deductible amounts. The plan $500, $750, $1,000, and $1,500. The benefits for these plans are generally identical. The thing that differs is the deductible amount and the coinsurance amount. FMIP will be offering 2 plans, the $500 and $750 deductible plan. We didn't choose not to offer the plan $1,000 and $1,500. These plans simply did not meet the federal benchmark requirements, and they would have required significant changes to offer those plans. One of our intentions in operating the federal pool was to try to make things as easy and understandable as possible to the consumers out there so as not to create confusion in the marketplace. Some of the benefit differences between OMIP and FMIP. The OMIP plan, as you know, has a 6-month pre-existing condition wait period. So for somebody coming in with a pre-existing condition, whatever that condition has been that they've sought services for in the 6 months prior to their application, that condition would not be covered for 6 months, or for the first 6 months of coverage. The federal pool, or FMIP, does not allow that. U.S. citizenship is not required in OMIP. It is required in the federal pool. The medical annual maximum out-of-pockets are identical for each OMIP and FMIP. However, when we look at drug annual max out-of-pockets, there is a difference. OMIP has no prescription max out-of-pocket. The Plan 500 and 750 for FMIP does have a max. There's also a difference in transplant coverage. The OMIP transplant coverage, the maximum benefit is equal to the lifetime max, or $2 million, whereas FMIP has a $250,000 limit per transplant. So applying for the Oregon Medical Insurance Pool or Federal Medical Insurance Pool, we have redone our application. It now serves both of these pools, so there's a single application. You can download that application and the handbook. I highly recommend downloading that handbook and going through it as well. That is out on our website. Something new for those of you who have worked with OMIP over the years is we now have a medical provider attestation, which is part of the application. What this means is if somebody is coming in via one of the medical conditions on the medical condition list in the application, they must also have a medical provider attest or provide a signature in the application that they do in fact have that condition. A doctor's note will also suffice if that's easier for the applicant. However, the doctor's note must also indicate that the individual has that same condition that they've marked in the application. Coverage will be the first of the month following a completed application. If the application is not complete, then that could delay coverage to the next month. As I mentioned before, applications received in the month of July will first be reviewed for federal medical insurance pool eligibility. If they're not eligible for the federal pool, then they will be reviewed for the Oregon Medical Insurance Pool. If you have any questions, please email us at omip.mail@state.or.us. You can also keep up to speed with any new developments or any changes on the OMIP website. We will be posting an FAQ that will have a lot of details to many of your questions over the last couple of days with regard to the Federal Medical Insurance Pool. Thank you very much for attending today's webinar, and feel free to call.